let's just jump straight into this explainer, right? Today, we're rethinking health, and we're looking at what I honestly think is a massive paradigm shift. It's this idea that modern healthcare desperately needs to see the whole story, not just a snapshot. We live in a time where our ability to collect medical data is just unbelievable, right? It's unmatched. But paradoxically, that exact same system often completely misses the actual, continuous, evolving story of a human life. So we're going to unpack that core argument today. How relying on isolated snapshots misses vital changes, how all that information stays incredibly fragmented, and how we can actually fix this by letting understanding accumulate through what we'll call a living thread.
You know, we really have to start with this incredibly relatable patient sigh. I suppose I'll have to tell the whole story again. I mean, if you've ever had to navigate the healthcare system for yourself or maybe for a loved one, you have absolutely felt this exact kind of exhaustion. We really want to ground our whole philosophy today in this deeply human reality. It's just so frustrating. You sit down with a highly trained professional in this fragmented system, and despite the absolutely massive file of records they theoretically have access to, you realize, yep, we're starting from square one.
So let's get into Section 1, Medical Snapshots Miss Change.
Now, to be clear, individual clinical encounters are entirely appropriate, and the clinicians you see are highly competent. The issue isn't the people, it's the overarching architecture. A blood result, a scan, a diagnosis, a prescription. These are the isolated snapshots that modern healthcare is literally brilliant at capturing. Each piece of information might be 100% accurate, but look at how this data just piles up in separate, disconnected silos. The next clinician might inherit your lab results, sure, but they completely lose the clinical reasoning that led someone to order that test in the first place.
And here's the reality. Human beings aren't snapshots. We are trajectories. Our health unfolds across time. It whispers through change. Maybe it's a really subtle decline in your exercise tolerance, or a slowly shifting sleep pattern, or even a medication that works okay but causes this weird, mild side effect. These are fluid movements over time, but static snapshots, especially ones taken months apart, easily miss the trajectory of those subtle yet absolutely critical changes.
This perfectly illustrates why we've got to distinguish between a simple symptom and a true signal. A symptom is just something you experience in a single moment, but a signal, well, that's an observation whose significance only emerges from context. Picture a healthy young athlete who gets mild chest discomfort after a meal. Without context, maybe that's just diagnosed as acid reflux. But if we have a context, say a subtle decline in their stamina, worse sleep, and a family history of premature heart issues, suddenly that exact same symptom is a blaring signal. A snapshot misses the pattern. A trajectory actually catches it.
Moving right along to Section 2, Information is not understanding.
This really gets to the central complication of modern medicine. There's a profound difference between just possessing medical data and actually making sense of it. A modern hospital can generate literally terabytes of data for a single patient every single year. But information is just knowing what was recorded. It's the raw material. It's knowing the potassium level on a chart. Understanding, on the other hand, that integrates context. It asks, okay, why does this specific blood pressure matter for this specific person right now? Understanding integrates relationships, it integrates uncertainty, and it integrates the actual lived experience of the patient over time.
Let's walk through a hypothetical patient's timeline to see exactly what happens when data gets fragmented like this. Step 1, a symptom occurs. Step 2, the exam is reassuring. Step 3, the test comes back normal. Step 4, time passes. Step 5, the symptom returns. And boom, this is exactly where the system breaks down. When that person sees a new clinician at Step 5, a completely new, separate record gets created. That frustration we talked about earlier, it comes from this exact moment. These individual files remain totally isolated, even though they belong to one continuous health story of one human being.
Because patients live continuous stories, right? Life doesn't just hit pause between doctor's appointments, and neither does your health. New habits are formed, your sleep fluctuates, your stress levels go up and down. When a healthcare system relies purely on disconnected episodes, all that vital understanding just vanishes into thin air in the spaces between those visits.
It's kind of wild to think about, but a system can know so many things about a person. It can literally hoard mountains of their data and still completely struggle to understand what is actually happening to them. The truth is, we don't always need more data, more tests, or more invasive surveillance. We often just need the pieces of information we already have to actually connect. Which brings us to Section 3, the living thread. So how do we actually fix this fragmented system? We have to shift from an archive of static files to an accumulation of context. In practice, this is what we call the living thread. It's how a healthcare system should carry your context forward. From that very first symptom on day 1 to a recurrence in year 1, all the way to a much deeper understanding by year 2. Instead of starting from zero and making you tell the whole story again, the next clinician gets to begin further ahead. They inherit the reasoning, the context, and even the unresolved questions from your very last visit.
There is a really powerful principle here that completely transforms the goal of a doctor's appointment. Every meaningful healthcare encounter should leave a person's health a little better understood than before. It's not just about, checking off tasks, ordering a test, and dropping some notes into a file. It's about advancing shared wisdom. It means the consultation you have today actually becomes part of tomorrow's wisdom.
And finally, Section 4, Rethinking Healthcare's Future.
So what does it actually look like to put this philosophy into practice and shift away from these isolated medical snapshots? Well, it requires a few core principles. First off, we have to start stewarding understanding, not just hoarding files. Second, we must keep technology secondary. Look, AI and modern tech are fantastic for spotting patterns, but they have to be restrained, elegant companions. They shouldn't be these futuristic replacements that just constantly surveil us. And third, we have to preserve the clinical reasoning and the unanswered questions. The next doctor needs to know why a decision was made, not just what decision was made.
Now, these exact concepts happen to be the foundation of Dr. J. Michael Pounder's forthcoming book, Rethinking Health. His work explores how we can take these principles and practically shape clinical architecture. It's essentially a doorway into a system that truly values continuous clinical understanding. And to be clear, this isn't about pitching some specific software platform or getting bogged down in app names. It's about a fundamental shift in philosophy that completely changes how any healthcare system should be built to serve its patients.
I want to leave you with this provocative thought. It's really the ultimate question we have to ask ourselves, whether we're patients, providers, or innovators. What might healthcare become if understanding accumulated instead of repeatedly starting over? Thank you so much for joining me for this explainer. I really hope it sparked your curiosity to explore how we can finally start seeing the whole story.